I believe that the first step that health systems can take in order to prepare for the future is to really double down on their patient insights. We know that there's a big difference between someone who is generally healthy and someone who is chronically ill. And we tend to use the word patient to lump everybody together. And I really believe that it's important for health systems to really get underneath the difference between someone who is dealing with an acute illness, who is generally healthy and is interested in a health and wellness routine, and someone who is managing a chronic disease. That patient that's managing that chronic disease is dealing in an ecosystem of different pieces and parts and caregivers and communication channels and care plans, and they're trying to navigate a system in order to stay alive and to live somewhat of a quality of life. Where on the other hand, you might have somebody who's generally healthy, who's really interested in yoga and fish oil. The way that that person views the world and what's important to them is going to be a little bit different. And so the way that you treat them and the things that you talk to them about and the care plans associated with that person is going to look really, really different than someone who you're treating that has to deal with lots of different care providers in a system of care that has lots of different specialists that are talking to and treating that patient. So what I really mean by that is we talk a lot about EHRs and technology being able to connect people's care plans into one care plan. But you don't always have the different providers talking to one another. So if you are someone who has a chronic disease, you are waking up every single day trying to manage that chronic disease. It is what you think about on a consistent basis, and you're dealing with all sorts of different specialists in your system of care. It's those insights and that empathy for patients that are really going to drive the different products and the services associated with those health system strategic goals. So understanding the context by which they live, their social economic situation, what they care about, where they are on the spectrum of health and wellness, all of these things are really, really important to the future of care within a health system because those patients are the ones that are either going to choose you or they're not going to choose you. And they're going to take those surveys that you're getting measured on as far as the patient experience is concerned. So it's just really, really important for health systems to double down on an understanding of who patients are and their health and wellness journey and how that health system fits into that patient's world or does not.